So this video is going to outline content from chapter 6, really talking about the importance of trustworthiness and transparency within organizations, within supervision, as trauma-informed leaders, in psychodrama, and in group psychotherapy in general. Trust is really foundational in the healing process and must be earned by the professional. It's not something that trauma survivor is just going to come into therapy, come into treatment, and automatically trust us because we're professionals. It's really going to be something we're going to have to work for and demonstrate our trustworthiness. So it makes sense, considering how foundational trust is, that SAMHSA would elevate trust and transparency as the second of the 6 trauma-informed principles. Now, as professionals, when we look at this second trauma-informed principle, we need to remember that trust goes both ways. It's really a reciprocal and a relational experience. That, of course, we need to work at developing trust, gaining the trust of our clients in order to best help them. But it might also mean that we have to show our clients that we trust them, that we trust in their ability to heal, that we trust in their ability to choose what's best for them, that we trust in their ability to join us or to allow us to join them in this difficult work, that we trust that they, at their core, know what they need and what's best for them. And this can be tough. I mean, there's real limitations to trusting clients depending on our work setting and the types of clinical issues we're working. But research really confirms this, that we have to offer trust to our clients if we expect them to trust us. Mistrust is only going to breed more mistrust. Our clients will sense our mistrust in them, and they're unlikely to feel safe or seen, or even to want to be in relationship with us or to share difficult things with us if they feel that we don't trust them. We have to really trust our clients as collaborators in the trauma recovery process. And again, that trust that the client is the expert in their experience. Carl Rogers, who is a famous counselor, highlighted the importance of trust in psychotherapy, suggesting that the therapist should specifically trust in the unrealized potential of the client. So this means that we trust that there's potential for healing, for growth, for learning within any client that comes in front of us. And I think this is really foundational to believing in the goodness of people and believing in their ability to heal. Always a fan of the humanistic counseling and psychology tradition in Carl Rogers. Again, there's going to be limits to our ability to trust our clients entirely, but perhaps we can still trust in their ability to heal, even if we're working with a client that's demonstrated dishonesty or has lied to us, or engages in other behaviors that suggest they might not be entirely trustworthy. Even then, we can still trust in the unrealized potential within them. Clients are really going to feel it when we trust them. And we're going to demonstrate it non-verbally in the types of suggestions that we offer to them, in our responses to them, in our voice tone, in our hesitation in our responses, and in the way that we structure our sessions and our groups if we're doing group therapy. When we use different group structures like smaller groups or sociometry, it really demonstrates our inherent trust in the group to show up and support each other as peers, in that we're positioning group members as agents of change for each other. We're positioning them in smaller groups to support each other, to be therapeutic agents for each other. We also demonstrate our trust in clients when we believe in their ability to find their own way, to heal themselves with the right support, to ask for help when they need it, and to bounce back from tragedy and work towards achieving their goals. So it's important for us as professionals to consider, how do our clients know that we believe in them and trust them? Do they really know that? And are there ways that we can more explicitly or indirectly convey our trust in our clients? And how do we actively safeguard and cherish the trust that clients extend to us as professionals? I mean, it's a real honor and privilege when someone that's experienced trauma and betrayal and struggles to trust others begins to trust us. And it's something that we have to protect and honor and really recognize as a huge step in the process.